Hi, my name is Caleb. I'll be your provider today. I want to do a thorough head-to-toe assessment. Just before I begin, I have a few questions for you. What would you like to be called?
Travis.
Travis. Okay, and this will be a little bit of a lengthy assessment. Have you been able to use the bathroom recently?
Yeah.
Okay, cool. Um, so I move on to the general survey. I observed the patient walking in. He had a steady gait, no issues with balance or no abnormalities with movements of his extremities when he was walking in. The patient is alert. He seems calm and ready for this assessment. Also appears clean and well dressed. Um, he, as far as orientation goes, can you tell me where you're at?
I'm at the clinic.
Okay. Can you tell me the date?
Today is May 2nd.
Okay. And the your name
Travis.
and who the president is?
Donald Trump.
Donald Trump. Patient is alert and oriented, times 4. Um, and judgment wise, so if you saw blue lights behind you, what would you do?
I would pull over.
You pull over. So patient's judgment is intact. So we're going to move on now. I'm just going to assess your head. Let's be head to toe, but we'll start with your scalp first. So I'm just going to palpate.
Okay.
Just upon initial inspection, the scalp appears clean. No flaking, no redness. I'm just going to feel here to feel if there's any notable abnormalities and deformities with the sutures of the scalp. And there's not any noted. There's a symmetrical. There's no symmetrical bilaterally. There's no particular deviations. So then from there we'll move on to the um, uh, eye exam. So we're gonna I'm gonna test your nearsightedness. So
Okay.
basically, I want you to hold this from about a foot away from your face.
Okay.
So you can just kind of hold it up just like here, and I want you to close your left, put your hand over your left eye, and I want you to read the line that you're able to read clearly the most. So
Okay.
start with the bottom line if you can read that.
Okay. LTFPH.
LTFPH. Okay, and then close the opposite here.
Okay.
Okay.
The LTFPH.
Okay, great. So 20/20 on the right eye and the left eye, and then we'll do them together with just
Okay.
eyes open.
The LTFPH.
Correct. So 20/20 vision bilaterally as well, both eyes. So then from there, we'll move on to the external eye assessment. So the eyelids appear to close symmetrically. They're clear. There appears to be no discharge out of the eye. The eyelashes are also um, clear, clean. There's not any deviations. They tend to go upward. The sclera is white with no vasculature noted. I'm just going to pull down a little bit just to see your conjunctiva, which is pink, clear, no discharge noted as well there. Now I'm just going to test your pupillary response. And I'll go ahead and check your pupil size before we mess with it. So they're about four bilaterally. And then I'm just gonna, okay. The left pupil is reactive, right pupil is reactive. And then I basically want you to look at my finger here. So I want you to, without moving your head, look at my finger, the end of my finger, and then I want you to look right behind me. Finger, and then back, behind me, back. So pupils are accommodating. So perilla is intact. From here, we're going to move on to the external ear. So I'm going to go ahead and start just by palpating the the mastoid, the tragus, and the pinna. There appears to be. Did you feel any type of tenderness with that?
No.
So no tenderness noted with that. They appear to be they're soft. The tragus is firm. No masses noted. I'm going to go ahead and also palpate your sinuses. So we're going to start with your frontal sinuses here. Cold hands here, and just tell me if you feel any tenderness at all there.
Nope.
Nope. And then your mastoid sinuses here, below the cheekbone. Anything there?
No.
Nope. So great. So then we'll go back to the ear. We've already done our external ear, so then we'll do our assessment on the middle ear here. and I will use the otoscope here, and I'm just going to pull the pinna upward and back here, and then I'm just going to point towards the nose and eyes here. The ear canal appears clean, some mild cerumen and fine hairs noted. The tympanic membrane is gray with no, doesn't appear to be any perforations. And then we'll do the same here, up and back here. Okay, ear canal, same here, mild cerumen noted, but otherwise clean, some fine hairs, and then a gray tympanic membrane with no perforations noted. Also want to go ahead and check with the otoscope your red reflex here. Okay. So I want to check, I want to have you just close your left eye if you can there.
Like cover?
Yeah. Okay. And then we'll check the other opposite side. Red reflex is intact. Okay. So now we'll move on to the mouth assessment. I want to go ahead and have you open your mouth and say ah for me. Okay, the uvula raises with the mouth opening. There appears to be no missing teeth there. All teeth are intact. I'm just going to pull down a little bit. The gums appear to be intact. They're pink. The mucosa is moist. The hard and soft palate also appear to be intact. And then the tongue is midline, shows no deviations. So go and appears to be intact and moves normally, symmetrical. Okay, so now we'll move on to the nose. So I want to go ahead. I'm going to look up in your nose here, and I'll use a different. Piece here, so it's not dirty. Okay. The nose appears on inspection appears midline with no deviations noted. So I'm just gonna look up here, turn the light on first. So just gonna have you kind of look up just like that. Okay. The nares appear intact. Mild redness noted, some fine hairs as well. Same with this right side here. And then I'm going to go ahead and have you to test patency of the nose, the nares. I'm going to have you put one hand on here and then breathe real deep. Okay. Same with the other side. Okay. Patency of the nares appear intact. Now we will move on to the hearing test, the whisper test. So I'm going to have you hold your hand over this left ear here, and then I'm going to whisper something to you. I want you to repeat it out loud.
Okay.
Red, blue, green.
Red, blue, green.
Great. And then other side. Blue, orange, yellow.
Blue, orange, yellow.
Okay. Hearing appears intact bilaterally. Now we'll move on to the thyroid exam. I want to first check for tracheal deviation. So I note that there's no jugular venous distension, and I'm just going to palpate here. The trachea appears to be midline with no deviations. I'll go ahead and feel here our carotid pulses are about a 2+ bilaterally. And then I'm going to listen as well. With the bell. Okay. The carotid auscultation, there appears to be no bruit noted, and the flow appears regular, and here sounds regular. Okay, so then we'll move on to the thyroid assessment. So I'm going to palpate your thyroid here. I'm going to have you take a drink of water, and I'm going to feel. Okay. The thyroid is palpable. There's no masses noted upon swallowing. So then we'll move on to our lymph node assessment here. We're going to start with preauricular, postauricular, occipital, post-cervical, deep cervical, superficial cervical, submandibular, tonsillar, submandibular, submental, and then I'm going to have you kind of lift up here, and then supraclavicular here, or subclavicular. Okay, there was no lymph nodes that were palpable on that assessment, and then we'll do our upper extremity assessment here. So I'm just going to have you kind of hold your arms out for me here. The upper extremities appear warm to touch. The musculature is tone. It appears even. I'll assess here and see our capillary refill. So our capillary refill is a 3+, and our we have 160 degree curvature, and there's no clubbing apparent on the nail on the right side, left side. Same thing, less than 3 on the capillary refill, about 160 degrees on the nail. There doesn't appear to be any clubbing. There is no edema noted as well either on our joints here. And then I'm going to feel for a couple of your pulses here. You're good there. Let's see. Our radial pulses are about a 2+. And then we'll check our brachial pulses are about a 2+. And then we'll just check our upper extremity lymph nodes. So we've got our lateral, okay, our central here, and then we would go just into the shirt here.
Okay.
And then we've got our pectoral right here.
Okay.
And then just going to lift, I'm just going to go right here, I'm sorry. Our subscapular. And that the lymph nodes on the left side, there is no masses noted and any tenderness at all.
No.
Noted. No tenderness, and they're not palpable. So, and then do the same thing here. Lateral, central here, and then pectoral. I'll just lift up the shirt right here. Pectoral, and then subscapular. And I cannot palpate any of those. Okay, so we're gonna start. We're gonna continue here to the posterior thorax. So go ahead and sit down here. You should be able to see that. I'm just gonna lift this shirt up real quick here. Sorry. So the posterior thorax, the back as a whole, the skin is intact. There doesn't appear to be any specific lesions. The AP diameter is about a 1 to 2. 2, 1. And I'll just palpate through here, and I'll feel all the curvature, or excuse me, the vertebrae of the spine. And they appear to be intact with no bulging. The paravertebral muscles also appear to be intact and even. I'm also just going to have you breathe normally here. I'm just going to feel here. Let's go. Okay, the respiratory pattern is symmetrical. There doesn't appear to be any uneven breathing pattern or increased work of breathing, no flail chest. So we would also want to get our vital signs right as we come in after we do our assessment on our orientation. I'm just going to check my paper once here to make sure I didn't forget anything. Okay, covers the first portion. Now we'll move on to the second portion of the exam.